guest, which is Dr. Donna Peacock. She's a principal lecturer and team leader of social studies at the University of Sunderland. Back in 2015, she launched a voluntary scheme for the police of Northumbria to assist in interviewing neurodiverse individuals. She was diagnosed with ADHD herself in 2021 and is currently focusing her research on vulnerable people as suspects, particularly in police stations. And I would like to hand over to her to give.
Okay, hello everybody. I'm just going to share the screen, get the presentation ready there. Okay, so thank you for the introduction. The research that I'm going to talk about today is actually from a few different projects that I've been involved in over the last few years, kind of thrown together into one theme though. So a couple of points I wanted to draw out of it. So yes, I'm Donna Peacock. I work at University of Sunderland. I'm a criminologist by trade, and I am very interested in work with vulnerable people. So as a quick introduction to that, in 2015, there was no appropriate adult scheme in the Northumbria region. So we were contacted, we were asked if there was any potential that we could maybe send a few student volunteers. I don't think any of us at that point really sort of realised how what that was going to entail. It's turned into something now which is a much larger scheme where we're providing support 24/7 right across the year. We've got currently 40 volunteers on our books. And to be honest, it's worked really, really well for actually giving the students that will have a good insight into people that they're going to actually be working with when we send them out into working in the criminal justice system. So there's been real benefits for the volunteers, but also it does mean that we're able to train those providers, the appropriate adults, so that we're providing a good service where it's not people just being kind of just dragged in off the street as it was beforehand, kind of hearing tales prior to the scheme being set up of just, you know, literally someone off the street or from a local organisation or pulled in from a local church or reliance on friends and family, which actually, you know, they can in law provide those services, but you're then putting in service where people haven't been trained fully how to do that. So we'll provide a fully comprehensive training scheme as well with qualification in line with the National Appropriate Adult Network, who we work very closely with. So if I'm honest, I have to say I don't think that this should be something that relies on volunteers. I think it should be a statutory service. I think it should be fully funded. And I think you could actually do a full degree on everything that I would like an appropriate adult to know. So we'll do our best within the schemes that are working, but I'm not in any way touting that I think it's ideal. So that's kind of where my interest in this work started from. So what I would like to run through with you today is 3 different projects that I've recently been working with. One of them was about appropriate adult participation in designing and delivering the services that are for them, which is a piece of work that I have worked on with Professor Steve MacDonald, whose work on Cuckoo and you would have listened to earlier in the day. And also with Dr. Faye Cosgrove, who specialises in policing and police organisation, and Dr. Pod, also of University of Sunderland, whose work is around participation. So I'm going to give you just some headlines from that project. We've also got a recent project along with Dr. Patrick Hutchinson and Claire Holland from the Local Liaison and Diversion Scheme, which looks at SLCN, that I'm just going to give you a little bit of a flavour of. And then a recent project that's been about interviewing of vulnerable voluntary attenders. So, like I say, some common themes that have came out of those that I just sort of want to draw together. But I did want to start by kind of identifying where the works came from, because none of this has been on my own. The Appropriate Adult Scheme relies on a lot of volunteers and you know, an entire team of lecturers at Northumbria Local Appropriate Adult Scheme working within Sunderland University who assist with that. And then you can see all of the other academic and practitioner colleagues that I've been working with on all of this. So none of it could have been possible on my own. So In terms of participation, there's been a lot of talk about, you know, people who are subject to services or where services are designed for them, being able to actually be involved in the design of those services. And I think really from a disability studies perspective, we've seen this being really promoted and quite accepted in a lot of areas. Criminal justice is really lagging in that. So people don't have a voice in services that are designed or run for them in the way that we would like to see. Quite commonly, there's been discussion around ladders of participation. Some of you might be familiar with Sherry Arnstein's very well-known ladder, where she identifies different stages of participation that start from, you know, kind of tokenistic, to being able to have some minor say, to actually being able to design and run and organise services. So starting from that point, we wanted to know what level of participation was there in appropriate adult schemes and how they were designed and ran, and you know how much participation there was, but also at what level. So just some real key headlines that came out of it. 72.7% of appropriate adult schemes reported no service user involvement at a decision-making level. So they weren't involved in steering groups, they weren't involved in management committees. So at a management level, very much services being ran and organised for people. In education and training, there was similar level, 68.2% reported no consultation here either. In terms of appropriate adult scheme service user feedback procedures, we also asked whether there was collection of feedback, how this was responded to, and alarmingly, you can see there more than a third actually said that this was not applicable. So it's not applicable on a survey, that you wouldn't want to take service user feedback. So that was quite concerning. So not only feedback not being collected, not being responded to, very, very low levels there. And like I say, schemes thinking it's not applicable to that service, so quite concerning. Along with that, we did actually collect some qualitative data because we wanted to get a bit of an insight of what the barriers were that were actually preventing the kind of level of participation that we'd like to see. So this fell into 4 themes really. So one was resources, largely around funding and time. So people said it had not been built into their funding streams. They did not have the time to do it. There was a lot of comment around the actual environment in which the interactions between an appropriate adult and the people who would use an appropriate adult service actually are interacting with each other. So, you know, you can see they're only seen inside the police station. It begins and ends in custody. So there's this discussion about whether it's actually appropriate to be asking people to participate in service design when you're only in contact with them for that particular duration at a difficult time. People commented on the nature of the role. You know, people are in crisis when we meet them. The interactions are one-off, they're very short term. So didn't think it was feasible in that way. There was some quite negative perceptions of the actual service user, where people were commenting that they felt that the service users actually would not be able to participate, so that they had not been able to be involved because they were vulnerable, because they weren't reliable, because they weren't interested, or because they didn't want to get involved. So that was, you know, some comments that were had made by scheme managers and scheme coordinators of appropriate adult services. And this went out, it was sent out by the National Appropriate Adult Network on our behalf to all of their scheme members, but also independently to basically the first 20 pages I could find on Google that had contact lists, because a lot of people don't actually sign up to the national network. So in terms of just making improvements here, I think what does need to happen, there needs to be more time made available, more money, more resources, more support, more sharing of best practice, knowledge sharing, which really these are things that the National Appropriate Adult Network does do and does advocate. I think our sense in analysing the data and actually in working, you know, would deliver a scheme ourselves or work with other scheme providers, is actually there is a will to do this. People do want to be involved. People do want to encourage more participation. They don't really understand it. They don't know how to do it. They don't know what it should look like. So I think really it's about where we're finding participation that does work, and service user informed services would need to be encouraging that sharing of best practice. So that was one project. The particular data I've shown you there comes from looking only at the adult section of the participants that we had. Some schemes only provide services for vulnerable adults. Some also provide services for children, and some concentrate solely on one or the other. So the stats I've just shown you there are relating only to adults. So that there's some more work going on that looks at the whole data set. The next piece of work that I just wanted to sort of give you a little bit of a flavour of is the work that we've been doing about SLCN, which Kim mentioned earlier on there. So thank you for that bit of an introduction, Kim. I have to really be very clear that this comes from the work of Claire Holland. Claire's an advanced speech and language therapist working in the northeast of England, and Claire designed a fantastic screening tool. She's been working with her colleagues in liaison and diversion to collect data using that screening tool, and she had a really very clear idea of what was coming out of that data. But I think being the only speech and language therapist for a very, very large police region, and being very busy in her job, she's needed to have some additional basically time and help and support to get the data analysed. So she does a fantastic job, very knowledgeable, and had been collecting the data before we got involved. So it's been an absolute privilege and a pleasure to be able to work with Claire. And I think myself and Dr. Hutchinson, who's the other researcher on this, count ourselves very lucky to have been able to be involved and have learned a lot from Claire. So really, I think when we look at SLCN, and Kim did talk you through a lot of this earlier on, SLCN needs are much more prevalent in people who are, appearing across the justice system at much higher levels than in the wider population. And when we look at actually what's required in a custody setting, the language that's required there, the levels of interaction that are required there actually make it really, really difficult for someone with a speech, language or communication need to be able to be fully engaged, to be able to access justice fully. So, for example, they need to process complex questions, difficult vocabulary being used, needing to actually be able to present a narrative in a particular order and to be able to remember that and articulate it clearly, and all amongst very, very heightened emotions and within a very stressful situation, where I think, whether you would have an identified vulnerability, this is an area where actually, as Roxanna mentioned earlier, we'd all find ourselves vulnerable in these settings, so particularly compounded for certain groups who encounter the police in these environments. So for a period between September 2019 and September 2020, Claire Holland, working with L&D, had over 1,000 screens completed. It's Claire's screening tool. Claire is very, very happy and willing to share any of her resources, and she's got the screening tool as well as a lot of other things. She really is a passionate advocate and wants to get this out. So if anybody wants to be put in touch with Claire and would want to see the screening tool or wants to talk a bit more about it, please do let me know and I'll put you in touch, because she very much welcomes that and is always happy to share her resources. So Claire had designed this screening tool. Basically, she's had the other L&D practitioners who were working within the same service completing these screens with people where referrals had been made. And just to give you a flavour of some of the key findings, 1 in 5 of those screens indicated a speech, language or communication need in either understanding, expression or conversation interaction. 1 in 10 of those actually indicated a need in all 3 of those domains. 63% of those referred for SLT specialist assessment. So these are the ones where they'd scored 3 points or more on the screening tool and then would be assessed by the speech and language therapist actually had no previous diagnosis. So that the headlines really, you know, we can pull out these figures. I think the key points to make here is that actually a lot of the work that's been done around SLCN has focused on young people. That there's starting to be more coming out that's around adults, but it's tended to quite heavily focus on young people because it's an SEN concern for schools and education, and I think it's followed on from there. But also, you know, if somebody's actually presenting with a particular diagnosis of, you know, a neurodivergent condition, a mental health condition, a learning disability, then actually that might indicate the need for a custody sergeant or, you know, a legal advisor to request other further support. And what this showed very clearly is that actually quite a heavy percentage of these people don't actually have any previous diagnosis at all. So they were presenting across young people, across adults, and across diagnosed and undiagnosed people. And looking at the rescreens that were then done, because remember, L&D practitioners conducting screens, they're not trained SLTs. So when professional rescreens were done by speech and language therapists, significant underscoring was found to have happened. You know, somebody who is a professional practitioner in speech and language would better be able to clearly score and identify those needs. So significant underscoring probably indicates that those figures, which I've just shown you there, you know, we can see that they're quite alarming in themselves. They're actually probably most likely underestimates. So what we'd be advocating for from that, we need to look at increasing SLCN screening to cover all suspects, detainees, arguably potentially victims and witnesses as well, but certainly looking at suspects and detainees. Screening to result in input from a specialist SLT. There's no sense in doing all of this screening and then there not being support to follow that up. So, you know, I think Claire's position is she thinks everybody should be screened. She thinks there should be a service up and down the country. But there's only one Claire currently. They have recently advertised for another SLT for the region, which was fantastic to see. And I think it's honestly as a result of Claire and her work and, you know, her really raising visibility about these this particular group of people who are in need of speech language communication support. So SLTs need to be embedded within each police force area. They're currently not. In the way liaison and diversion is delivered, there's a lot of variation in what's available in each police force area. I mean, and policing, you know, we understand is different from area to area, so that does need to happen. But our argument would be that there should be a permanent speech and language therapist attached to each force area. But also then that training of police officers and anybody in any other roles and services actually need to include that awareness. So that means that your speech and language therapist needs to be working closely with your appropriate adults, with your custody nurse, with other professionals in liaison and diversion, your police officers, your detention officers, anybody else that your suspects are going to be coming into contact with, because there needs to be a referral made before us. Is going to go via liaison and diversion, who would then bring in a speech and language therapist. Somebody needs to notice that there's a need and actually make that referral. So awareness needs to be raised with everybody who might be able to make that referral or highlight that there's a need there. The other final piece of work, and this is really just giving you a little bit of a snapshot of some of the project that we've been doing, working with the National Interview Advisor. There were some questions and concerns raised really about the levels of support for involuntary interviewing. So there had been a move towards really thinking about not bringing people into custody if we don't need to. So, you know, really considering whether there was an actual need to arrest, and that if there wasn't a need to have people under arrest, could they be interviewed in a voluntary way and then arrested at a later time if it became necessary. So that would be better for suspects, and, you know, would relieve pressure on resources and would be more fair and more just. So it was expected that this might make a change, that actually this might lead to a higher level of voluntary interviews and less interviews being conducted in custody. So the discussion around this with the National Interview Advisor was really what had happened over the last couple of years, and whether there had been sufficient support available for people who were being interviewed in a voluntary setting. So a voluntary setting could be another room somewhere else in the police station, you know, typically an interview room or a room off, you know, off an entry foyer. You know, it's not bringing somebody into the typical custody environment and that normal setting. So a standard meeting room. It could be off-site in any other venue or actually at somebody's home. So it's in the police station or elsewhere, but not in the custody environment. So the questions that were being raised about that was, you know, were people then still able to get an appropriate adult? Were they getting their free and independent legal advice in that setting? Were risk assessments being conducted? Was vulnerability being identified? I think we're all quite aware that there definitely are problems in how things are run inside custody. I don't think anybody would say that it's perfect, but I think in most cases, a custody sergeant would have a procedure, would have an awareness around vulnerability, would be making referrals, you know, where needed. And like I say, we know it's not perfect. We know there's difficulties around that, you know, identification of vulnerability. People have different ideas about what vulnerability means, where thresholds are identified and people are identified as vulnerable. So there is all of those debates going on. What we're looking at here, though, is if it's not actually going to the custody sergeant who's used to making those decisions and actually used to looking for and deciding around vulnerability, actually there could be then a concern about whether it's happening at all. So is the service, you know, at an even lower level? So really what we found there was that the use of voluntary interviews had been fairly steady across the period that we looked at, which was 2019 and 2020. Legal advisors were being called, appropriate adults were being called. I think the main difficulties that actually came out of it was around the ability to report. So anybody who was around this morning would have heard Roxana talking about the report that the National Appropriate Adult Network did. So that was Roxana, and she did that with Chris Bath. And what that did was actually looked at freedom of information requests from the police. And, you know, as a scheme coordinator, it was clear to me there that actually the level of reporting that the police were reporting wasn't matching up with stats that were apparent on my scheme. And we found a similar thing here when we've actually gone to the police forces and said, you know, how many voluntary interviews did you do? How many had an appropriate adult in attendance? How many had a solicitor in attendance? Where did they take place? The major problem was that they didn't seem to be able to retrieve the data very easily. Where the data was being collected, there was no clear flag, there was no clear data retrieval system. You know, it sometimes entailed having to go through individual records on a one by one. So it was really actually quite difficult for people to retrieve the data that we were asking for. In all cases, what we did find was that risk assessments were being conducted. Those risk assessments are not being done in the same way. They're using different systems, they're asking different questions, comparing one force against another. They're using different IT systems, some more successful than others. And where voluntary interviews are happening, particularly where they're happening outside of the police station, there's quite often duplication. So for example, a paper form being filled out in somebody's house, that then being taken back to the station and being typed up later, which increases the room for error in the recording. So I think speaking to interview leads across the forces and the information that we managed to get back from the forces, they've got policies in place, they're conducting, they're following procedures, they're conducting risk assessments, but it's very, very inconsistent. The recording in particular is very inconsistent, and it's really, really difficult to just get a clear pattern across the country because they're not all doing the same. So more work to do there. I think what we're going to be going back and looking at next, hopefully, is some comparison of the policies and procedures, because they are quite different, looking with a particular focus at the risk assessments, and trying to just do a little bit more of a qualitative, discussion with the actual force leads in each place about what's happening. So I think some conclusions from all of that, because I think you can see from the different areas I've been working in, there are common themes through them. I think what I would argue about all of these is there's lots of will. People who are running appropriate adult schemes do want to include user voices. People who are interviewing suspects do want to collect the data, and they do want to have, proper recording, and they want to have proper support involved. People working in liaison and diversion, and particularly in speech and language therapy, do want to have the screening take place. In every area that we've looked at, there seems to be lots of will. Everybody recognises the difficulties, everybody recognises the importance of all these issues, but none of it's joined up. It's not coherent, and it just actually means that in all of these areas, we've got a real patchwork of services and inconsistency in the quality of what's actually being provided. I think in an ideal world would have a very coherent, joined up system that's user-led, where everybody is fully assessed and everybody can get the support that they need. And it seems to be happening in pockets. Like I say, the will seems to be there, but there's a lack of funding, there's a lack of resource, and things just don't really seem to be joined up in all of these areas. And just a final point, I think, from me to end on, we can really increase these arguments and say, right, we should be screening everybody, we should be putting things in place, we should be redesigning services around user-led identified needs for speech and language and for any other needs. But actually, there's no point in doing all of that identification and identifying those needs in this ideal service if we're not then going to back that up by providing the service, or making sure that we're designing schemes and services to meet those needs. So like I say, I think particularly the speech and language identification, without putting some particular, therapists in to follow up on screenings done, there's no point in doing all that screening. There's no point in collecting all that user voice and then not actually designing a service around it and not meeting that need. So it really needs to be joined up and made probably more coherent at a national level. So that's me, thank you. I don't know if anybody's got any questions.
There are no more questions in the chat. So if there are no more questions, then I'd continue on to our next guest. 1 second. Lovely. So in that sense, I'll be going over to our next session. Just maybe as a personal experience, I've had my fair share with police in younger years, mainly as a witness, and I oftentimes had the issue that I became suspicious, at least in the eyes of the officers that were interviewing me. So for me, it's very interesting to see how things have evolved over the course of the last years, really. So our next